Hello to all students. In this video lecture, we are going to discuss urinary tract infection, which is also called as UTI. To understand the concept of urinary tract infection, first of all, we have to look at the anatomy of urinary system. Our urinary system is composed of two kidneys and a pair of ureter, urinary bladder and urethra. Kidney filters blood and removes the waste product, metabolic waste product like urea, uric acid, certain ions from the blood and make urine, which is passed out the body through urinary system. A pair of ducts which are known as ureters. These ureters transport urine from kidneys to urinary bladder. Urinary bladder is a sac-like structure which stores urine temporarily, and then there is a duct which is known as urethra, which empties urine from urinary bladder to outside the body. Urethra, the length of the urethra is shorter in females while it is longer in males. So female body tends to have more chances of getting urinary tract infection as compared to male. So first of all, we are going to look at the main symptoms of UTIs. The main symptoms include strong urge to urinate. Even your bladder is empty, but still you have an urge to pee and you go to washroom again and again. Burning feeling when urinating, a very severe burning in the urethra, which is caused by infection, and it is very uncomfortable. If you look at the urine, sometime it looks cloudy, which is the sign of pus in the urine, which is a sign of a severe infection in urethra, urinary bladder or kidneys. Sometimes urine smells very bad. Bloody or dark urine, which is also known as hematuria. In this condition, there will be small or large amount of blood in the urine. Feeling tired all the times and feeling shaky sometimes. Fevers and chills during severe condition of urinary tract infection. And there are some other symptoms associated with urinary tract infection like pain in the pelvic region, nausea, vomiting, etc. So if we want to confirm that it is a UTI infection, we have to do some blood test and urine test. So in the urine, we usually test for nitrites, which are produced as a result of the activity of bacteria, which is known as E. coli. At the same time, we also test for white blood cells, which is a sign of infection, and also red blood cell. If there are in the blood, that is maybe the sign of there is an infection and there is a damage to kidney or urinary tract. So if there is a confirmation that this is a UTI infection, then we go towards the treatment. But first of all, we are going to discuss what are the major causes of UTIs. So the major cause of UTI is bacterium, which is E. coli, Escherichia coli, which is usually found in the lower part of the gut, digestive system. And it is usually part of in the feces. So this bacterium can move from your feces into urinary system, especially in female body, because their urethra is very short and there is less protective system in urethra, and bacterium can easily pass from anus through urethra into the urinary bladder or up to the kidneys. But there are also some other strains of bacterium which can also cause bacterial infection. There is a fungus known as Candida albicans, which is also a major cause of infection in some patients, but in this condition there will be antibiotics cannot be used because there are certain antibiotics which work against fungi, and these special antifungal medications are used in that condition. So if we look at the categories of infection, so urinary tract can be divided into two parts, upper part and lower part. Lower part include urinary bladder and urethra, while upper part contain kidneys. So if the infection is in the lower part, which is urinary bladder, which is also known as cystitis, then the symptom little bit different. but most of the symptom will be same which we already discussed over here. So the next infection will be pyelonephritis, which is a more severe kind of infection which happens in the kidneys, and during this condition fever or chills along with blood in the urine, and there is a damage of kidney tissues. So we have to take more seriously and take more caution with this infection. There is one more type of infection which is known as urethritis, which usually occurs at urethra. And at the same time, I have mentioned earlier that urethra is shorter in female, and there is more likely chances of getting urinary tract infection in urethra more in females than males. There are also some other causes for this infection, like during activity, sexual intercourse, bacteria E. coli can transfer from feces or from anus into urethra to cause UTIs. There are some other diseases like diabetes which can also cause this kind of infection, fungal infection or bacterial infection. Unhygienic condition can also contribute to this kind of infection. So we don't know exactly what is the major cause, but this infection is very common in most of the people. It can happen in young adults, it can happen in adults, in older age, pregnant women, and etc. But we have to be very careful while taking the treatment of this infection, because it takes very long time to treat this kind of infection. So it's better to prevention is always better than cure. So if we take a hygienic measure, maintain our diabetes and take care of all the other things, we can avoid this kind of severity of this infection. So what is the treatment? The first line of treatment is usually antibiotics, which are usually used for longer period of time to treat such kind of infection. So there are multiple different types of antibiotics available, and which can be administered according to the situation, according to the weight, according to the severity of the infection, and it depends upon the physician. Cranberry juice can also be used, but there is no scientific evidence that cranberry juice helps to eliminate such infection. But there are some chemicals which are found in cranberry juice which helps to reduce the severity of the infection. So most of the time doctor advises us to take cranberry juice, which is usually comes in the form of a sachet, and you can dissolve it in little bit amount of water and then drink it. If the infection has been cured, some physician can also give you low dose antibiotic for a longer period of time so that the infection cannot recur. So low dose of antibiotics for longer period for chronic infection, so that infection does not come back again. Drink plenty of fluids, juices, water especially, so that there is more emptying of urinary bladder and there is less burning and pain in the urinary tract. Usually the antibiotics which is commonly used is phosphomycin, which is 3 to 6 gram per day, and it can be also repeated for longer period of time depending upon the type of infection. Cephalosporins, amoxicillin, which is a type of penicillin, fluoroquinolones, and there are some other antibiotics which can be used as a therapy. But this infection, because it happens at such places where there is a less blood supply, so we have to take antibiotics for longer period of time and stronger antibiotics so that the infection can be treated as well. And that's all for today. Take care.